This may sound alarmist. A third wave is coming. The principal scientific advisor to the Prime Minister of India says it's inevitable, but the exact time of its arrival cannot be predicted. What we do know is that this wave could cross age groups, putting children at the same risk as adults. We need to mask up and prepare. We also need to introspect, draw the right lessons from the past, fix the lapses, not the narrative. Hello and welcome to Gravitas Plus. I'm Palki Sharma Upadhyay. We'll begin the story from January 2021. When India was on the path to normalcy, we saw the lowest new cases in 8 months, the lowest death count in almost a year. Vaccinations had begun, hospitalizations had fallen. It appeared as if the worst was behind us, that it was time to open up. But the virus was evolving and mutating. The warnings were there. In February, reports say several experts voiced fears of an impending second wave, of a COVID tsunami. The message did not reach the top. Now we are told these warnings were vague, that while a wave was predicted, the severity was not. Then in March, a forum of scientific advisors set by the Government of India issued warnings that a new and more contagious variant was spreading. But no significant containment measures were taken. Instead, it was declared that we are in the end game of the pandemic. The real task of preparing for this wave was lost in the din. The result was this. On March 15th, India reported 24,000 new cases. This figure increased to 53,000 on March 30th, 1 lakh by April 4th, nearly 2 lakh by April 14th. And despite this colossal spike in cases, 2 mass public events were held as per plan. Number one, the 2021 Assembly elections. 5 states and union territories went to polls. Pretty much every political leader, from union ministers to opposition leaders, from chief ministers to the Prime Minister, everyone drew thousands of people at their rallies. And event number 2, the Kumbh Mela in Haridwar, which was attended by more than 48 lakh devotees, more than 4.8 million people. There were no masks or social distancing. Both these events, the dip and the ballot, ended up being super spreaders. The figures tell you the story. Between April 10th and 14th, nearly 2,000 people tested positive at the Kumbh. When the congregation began, daily cases in Uttarakhand stood at 500. By the time it was called off on the 17th of April, the daily cases had grown to 2,700 plus. In Madhya Pradesh, and listen to this, 99% of the Kumbh returnees tested positive, 99%. At least 22 could not be traced. The elections had a similar outcome. In West Bengal, each phase of the election saw a spike in daily cases. They went from 812 on March 27th to 16,403 by April 27th. Tamil Nadu, daily cases went from 474 on March 1st to nearly 8,500 on April 16th. Kerala, the cases went from 2,500 on April 2nd to 10,000 on April 16th. It was said at the time that election rallies did not contribute to the spike in cases, and we have a lot to say about that, but I'll let the figures do the talking. On March 1st, the growth rate of daily number of cases in non-election states was 6.09%. In states witnessing elections, it was 6.13%. Cut to the 15th of April and look at how the graph changes. In non-election states, it came down to 3.01%. In election states, with rallies, it went up to 7.99%. Do you see the difference? That's what super spreader events did. Yes, this is an unpredictable virus, but what did India in was poor planning and politics. It did not have to be this way. The situation could have been avoided. The heartbreaking scenes outside hospitals, the desperate run for oxygen, the SOS calls for medical aid, the waiting list for last rites, the sight of burning pyres, of overwhelmed burial grounds, all of this could have been contained. Let me say this too. India was always the perfect place for a virus like this to run wild. We are a vast country. We have 1.3 billion people. Social distancing is alien to us. We have high rates of diseases and a struggling health infrastructure at the best of times. We were never ready for a pandemic. Let me show you more numbers. Our healthcare spending in both public and private sector, it has been 3.6% of the GDP for the past 6 years. This is among the lowest in both the developed and the developing world. The US spends 16.9% of its GDP on healthcare, Germany 11.2%, Brazil 9.2%, South Africa 8.1%, Russia 5.3%, even Thailand is ahead with 3.79%. And I know this cannot be changed overnight, but we had several months to make arrangements. 1 year back, when the first wave hit, the empowered group of officers set by the Centre for an Effective Pandemic Response red-flagged oxygen shortage in the months to come. The group said we needed to produce more or cut down supply to industries. But did we heed the advice? Then in November 2020, a Parliamentary Standing Committee on Health flagged the same concerns. There was an inadequate supply of oxygen. Yet, it was only on the 22nd of April this year that the supply of oxygen to industries was prohibited. By this time, the demand for medical oxygen had reached about 60% of the total daily oxygen production. And today, oxygen shortage is proving to be deadly. The only saving grace has been India's diplomatic record. India provided the world with vaccines, and now the world is returning the favor. Tens of countries have pledged critical aid to New Delhi. Plane loads of oxygen, ventilators, testing kits, masks, antiviral drugs, you name it, and India has been getting it. But are the people of India getting it? This is the second issue we have to address, logistics. We are facing a logistical nightmare. We are getting oxygen from outside. We are making enough at home, but we are struggling to transport it. Last month, a lot of foreign consignments had to sit at airport hangars for several hours as hospitals across India gasped for breath. Why? Because until now, we did not have a mechanism in place to distribute these supplies. The work on this began only on the 26th of April. And it was on the 2nd of May, after one long week, that the Health Ministry issued a standard operating procedure, SOP guidelines, for the distribution of foreign aid. Do you know how many Indians died in these 7 days? 23,000. Right now, for many, vaccination has become the last hope. But where are the vaccines? India, the world's largest vaccine producer, is running short of vaccines. Critics say it's because we shared vaccines with the world. We provided 60 million doses to 70 countries. But we must remember that vaccine Maitri is the reason we are seeing the kind of global support that we are today. Vaccine Maitri is not India's problem. It never was. Government negligence, unclear messaging, corporate profiteering, opaque contracting, differential pricing, patchy record keeping, inequities in the global pharma market, these are India's problems. Who should take the blame for these problems? Health is a state subject in India. The primary responsibility for healthcare lies on state governments, but disaster is a federal subject. The second wave is the biggest disaster that we've ever faced. Neither states nor the centre can escape the blame. They take credit for positive outcomes. They must take the blame for this mess. It's another matter that a blame game will not save lives. But we need to rethink how we organize our politics. We cannot have a system where the centre and the state do not even see eye to eye. So we've put together some challenges that governments must address immediately and preferably together. Number one is proper estimation and communication of vaccine procurement. Long queues outside vaccine centres are not helping anybody. They're only making things worse. Number two, a crisis management team. We don't have one. We need a team of public health and management experts, a task force that can be replicated at state and district levels. How long will we depend on social media for supplies? Challenge number three, breaking the transmission chain. We need regional, local and phased lockdowns, a complete ban on any religious or political gathering. And number four, black marketing and hoarding of medicines. This is a real challenge. We need stricter punishment for both of them, or perhaps a state-level committee. The government of Odisha has formed one. Other states could do the same. The fifth is precaution. We need to mask up and keep it on. The sixth and last challenge, end the city-centric approach. We don't even know what's happening in rural India. A large part of the suffering in small towns is unchronicled. We've all been overwhelmed by this pandemic. We have to be more cautious than we've been. As a community, as a society, as governments, we've got to be more tough. It cannot be business as usual. We need to take lessons from our past. India has always been a country with a strong sense of community, and it reflects in today's digital world. We have come together as a community on social media. Individuals across political ideologies, across religious beliefs, across barriers, class barriers, are rallying their network and resources to help those in need. Only the sense of community could reflect in our political system. Stay safe.